Imagine a world where 1 out of every 4 people struggles in silence with anxiety, depression, or stress. Picture someone waking up every day, going through the motions, but internally feeling overwhelmed and exhausted, unable to share what they're going through. In 2024, mental health has become one of the most pressing health issues globally. From the aftermath of the COVID-19 pandemic to the pressures of modern-day living, people of all ages and backgrounds are experiencing mental health challenges in unprecedented numbers. According to the World Health Organization (WHO), mental health disorders are now one of the leading causes of disability worldwide. Conditions like anxiety, depression, and burnout are affecting individuals not only in their personal lives, but also in their workplaces, homes, and schools. Despite the growing awareness of mental health, stigma remains a significant barrier. Many people still feel ashamed to admit they are struggling, believing that seeking help might make them appear weak or incapable. This stigma is particularly harmful because it prevents individuals from getting the help they need. As a result, untreated mental health issues can escalate, leading to more severe outcomes such as substance abuse, self-harm, or even suicide. Mental health is not just an issue for individuals, it's a public health crisis that affects societies as a whole. The economic burden of untreated mental health disorders is staggering. A report by the World Economic Forum estimates that mental health issues will cost the global economy $16 trillion by 2030 due to lost productivity, healthcare costs, and social services. These numbers are alarming, but they also underline the importance of addressing mental health on a global scale. Every October, World Mental Health Day seeks to bring these issues into the spotlight, encouraging conversations about mental health and promoting action to reduce stigma and improve mental health care access. This year, the theme focuses on mental health in an unequal world, highlighting how social, economic, and cultural inequalities exacerbate mental health disparities. In this unequal world, access to mental health care often depends on where you live, how much money you earn, and even your gender or race, but the message is clear. Mental health is as important as physical health, and we must start treating it that way. The benefits of addressing mental health are vast, spanning individual well-being, workplace productivity, and societal health. At a personal level, mental health plays a critical role in how we think, feel, and act. It affects how we handle stress, relate to others, and make choices. Individuals who seek treatment for mental health issues, such as therapy or counseling, often report feeling more in control of their lives, developing better coping strategies, and improving their relationships with others. One of the most significant values of mental health awareness is early intervention. Recognizing the signs of mental health issues, whether in yourself or in others, allows for timely support and treatment. For example, symptoms like constant fatigue, loss of interest in daily activities, or persistent sadness might indicate depression. Anxiety, on the other hand, could manifest as constant worrying, irritability, or difficulty concentrating. When these signs are recognized early, interventions like counseling, medication, or lifestyle changes can dramatically improve outcomes. Mental health isn't just important for individuals. It has a profound effect on workplaces and businesses. According to the National Alliance on Mental Illness (NAMI), untreated depression costs U.S. companies $44 billion annually in lost productivity. Employees who struggle with mental health issues often miss workdays, underperform, or may even leave their jobs entirely. On the flip side, organizations that prioritize mental health see improved morale, increased productivity, and reduced turnover. By providing mental health support, such as employee assistance programs (EAPS) or mental health days, employers can create a healthier and more supportive work environment. On a societal level, addressing mental health can alleviate strain on public health care systems. Organizations like the National Alliance on Mental Illness (NAMI), Mental Health America (MHA), and the World Health Organization who are leading efforts to improve mental health care access and reduce stigma. Your support can help fund research, provide services to those in need, and promote mental health education around the world. You can also support mental health advocacy at a policy level. Advocate for mental health education in schools, ensuring that young people are equipped with the tools they need to manage stress and seek help when necessary. Push for policies that expand access to mental health care services, particularly for underserved populations. By supporting mental health initiatives, we can create a more equitable and supportive society. Finally, Consider donating to mental health organizations that are working on the front lines to provide care and raise awareness. For those who may not be personally struggling, you can still play a vital role in supporting mental health. Start by having open conversations about mental health with your friends, family, and colleagues. Normalize the idea that mental health is just as important as physical health and that seeking help is a sign of strength, not weakness. The more we talk about mental health, the less stigma there will be. If you're an employer, take steps to support mental health in your workplace. Consider implementing mental health days, offering access to counseling services, or creating a culture where employees feel comfortable discussing their mental health challenges. By prioritizing mental health, you can improve both the well-being of your employees and the overall success of your business.